Hey there. Good morning, home health heroes. This is Amy Register with the home health mentor, Teresa Register. Today, we were talking about what we could do to bring you value, to bless you, to lift you up. And my mom has put together some conversation points surrounding OSHA's emergency temporary standards. If you are thinking that you're safe because you've had a recent survey, if you are thinking that you can be nonchalant about worrying about COVID because you might be in the clear. Well, we hate to be the bearers of bad news, don't we, Mom?
We do.
All right, let us know what's going on and why might people, even who had a recent survey, need to be paying attention to OSHA's emergency temporary standards.
Okay, thanks, Ames. So let me preface this by just saying if you've been in home health very long, you know that there are all kinds of requirements for various kinds of plans. We had not too many years ago, I think it was fall of 2017, they required that every agency have a emergency preparedness plan. We've had to put together quality assurance plans, a respiratory protection plan, infection control plan. So it's nothing new for an organization to have to come up with another kind of plan. So this summer, we have we've added the requirement, or we've had added to our list of requirements, the requirement to have a COVID-19 healthcare emergency plan. And it was mandated by OSHA, and it was put into the Federal Register on June 17th of this year. So if you want to look it up, that's where you would probably want to go to look at the specifics. We're also
Is that the link that you sent me? If so, I
No,
just
I was
wanted to
just going to
mention.
say the link
Oh,
that they're going to see with this is a place to go to find a template to help them put together their actual plan. So I'm going to hit some of the highlights, but anyone who is actually going to write the plan will want to go and spend some time working with that template. So keep
okay.
in mind that the template is for all kinds of businesses. And so it's not specific to home health, but that's where our home health expertise comes in. We have to make it applicable to our particular type of business. So that's where you can go to find the template. So agencies or any kind of business that has 10 or more employees has to ensure that the plan is put in writing. You can't just, expect for someone to show up and you say, well, we have a plan. This is what it is. If you have 10 employees or more, it has to actually be in writing, and you have to actually be able to hand that to an OSHA regulator to let them look at what the plan says.
What if you have 9 employees?
Then you're exempt. I mean,
Wow,
you have to have a plan, but your plan doesn't have to be in writing.
that's so
So
cool. You could just have it like jotted down on a 3M sticky note or something,
I guess it's
or
just the way
saved
they
in your
wrote it.
brain.
I guess
Huh.
sometimes they write these things because it may be someone who is just hiring someone to do yard work or to care for someone in their home, that kind of thing. So again, it applies to all kinds of businesses. So it can be someone who just has 2 or 3 employees, and they don't have to put it in writing. They should have a plan. They should be able to address any of these issues, but it doesn't have to be in writing.
Awesome.
There are very few home health agencies that would be exempt from this. I will just say it that way.
I feel like
Um,
someone's getting fired today just to avoid writing the plan. Sorry.
No, I don't think that would be the case.
Hey, I'm here for humor. You got to let me have a joke now and then.
Definitely. You add that lightness to the conversation, the levity.
Yep.
So the first thing, obviously, that you need to figure out is, does this apply to your business? And if you have 10 or more employees, then and that would include you if if you work there, because there's a lot of owner administrators who are also registered nurses that see patients. Boy, hold on a sec. So in most home health agencies, this is going to apply.
Mm-hmm.
So then the next step is, once you know that you need to have this, then you'll want to customize it to fit your particular agency and your type of services that you provide. So the template is going to walk you through this, but there are some things that I'll talk about that apply specifically to home health. So the first thing is, what is the purpose and the scope of this plan? So the plan obviously is to make sure that you're protecting your employees. This particular requirement, again, focuses on your employees, not your patients specifically. Okay. OSHA has regulations that deal with employment issues. So this is, how are you going to protect your employees and keep them safe and protected from exposure to COVID? And that can be primary exposure from, another source out there, or it can be employee to employee. So you want to make sure that you understand that this applies to employees.
Got it.
So in home health, obviously, we are likely to be going in and out of patients' homes. So one of the options is to just say that we work in different settings, but they're all similar. And so, obviously you don't have to have a different plan for every person's home. But if you do business in a clinic or a different kind of a setting, some agencies have infusion centers. So depending on what kind of settings you have, you want to make sure that your plan covers each of those types of settings. For most agencies that I've been part of or surveyed, the only thing that's likely to apply is the one that deals with patients' homes, patients' residences. Mm-hmm. Within that, you'll have patients that are residing in assisted living facilities or maybe a retirement community. So if there's, whatever kind of setting your staff will be working in, you do have to make sure you address if there's something different about how you would protect your employees within that setting.
Okay. Sounds good.
Yeah. Okay. So the second thing is, you're going to talk about roles and responsibilities. Who in your agency is in charge of making sure that you are reviewing and updating your plan if things change or as things change, and who is assigning, who has the authority to assign responsibilities within the plan. Who's going to do what? Who's going to be responsible for disinfecting any equipment or obtaining equipment? So roles and responsibilities for this plan, for reviewing it, for updating, assigning, all of that kind of stuff. Next is you have to do a hazard assessment and talk about worker protections. So if someone has an emergency preparedness plan, they've already probably done a hazard assessment that covers transmission of infections. So they might be able to pull some of that from another plan that they already have in place.
Yes, repurpose it.
But look at the hazards that would apply in your particular setting. For home health, you're probably it's going to be a pretty straightforward kind of discussion of the hazards. And you're probably, like I said, not going to have a lot of variation in how you are protecting your workers. And again, some of this would probably be able to be taken from an infection control plan. So use whatever plans you already have, draw from those so you're not having to maybe do everything from scratch. So in a home health agency, you've basically got people coming in and out of an office, and those same people or part of those people will be going in and out of patients' homes. So you have to think in terms of your office as being one setting and patients' homes as being another type of setting. So you'll probably have at least those two settings that you have to be concerned about. So in talking about how you're going to protect your staff, obviously you're going to cover personal protective equipment and the recommended physical distancing, any physical barriers that you need to have in place. Some agencies use face shields in addition to masks. You'll also want to talk about cleaning and disinfection, and then talk about your particular agency's policy and procedure on vaccinations. Of course, we've all heard all of the encouragement from the powers that be to, encourage your staff to be vaccinated. I won't go into detail on that because that is obviously, agency specific right now. And then you also will want to talk about training. How are you training your staff? So these all fall under the heading of your purpose and scope. So I'm still covering that.
Hey, Mama.
Yes.
Can I have you pause for 1 second? I have a note here from somebody who's watching who says the connection isn't very good. There's some skipping and repeating, so I just want to pause and see if you can check your connection.
Okay.
You see if your signal's strong or if it's looking weird. It could very well be something with the StreamYard. If yours looks good, mine looks pretty strong over here, actually.
Mine looks fine.
Okay. Sorry about that, Michelle. We'll keep on going, but if this needs to be reviewed and re-put up, we'll look into that.
Yeah, if we have to redo it, I mean that we can redo that. If it's that bad, we'll listen to it and see.
Yeah,
I guess
and
it
if
could
anybody
be
else is listening and it's better for you, let us know. Michelle says thank you. Yeah, okay. Well, let's keep on with it for these moments, and then we'll listen back, and if we need to redo it, we'll schedule that in.
Okay. Something that I found interesting that OSHA mentioned in their discussion of this plan is anti-retaliation, and that's anti-retaliation against an employer by an employee for for the employer doing what they're mandated to do. So I guess that's OSHA's way of protecting the employer. So
Yeah,
it was
we
just
don't need
interesting that usually it's the other way around. It's usually the employer can't retaliate against an employee, but in this case, it's the other way around.
right.
So yeah, that was
Knowing
interesting.
how tricky the COVID situation has been, and yeah, it's probably why.
Yes, yes. Um, one of the other requirements that I think everyone is aware of is that whatever plan is implemented has to be at no cost to employees. So you can't say to your employees, you're using too many gloves or too many masks or whatever, so you have to provide your own.
Mhm.
And that might seem kind of funny, but I have actually surveyed agencies that somehow thought it was okay for them to make their employees buy their own hand sanitizer and barriers, for bag barriers, that kind of thing. That was,
Oh,
yeah. So just to
stressful. That's so stressful to me. Like, if your agency has to penny pinch at that level, like, let's look at something else. That's rough.
well, and from a surveyor standpoint, you can imagine what I then began to ask, you know, and why I wanted to know a little bit more about their budget and their budgeting process. So
Yeah.
yeah, so whatever is part of this plan has to be at the employer's cost, not the employee cost. And then you do have to make sure that you're keeping records on whatever you're tracking or providing. For example, you'll want to make sure that you can show, that you've been purchasing appropriate protective equipment for your staff. You'll want to make sure if you have staff who have been vaccinated and you are someplace where you know that legally you can ask for that information. You might then also want to show that you're aware of which of your staff are vaccinated or not. That gets a little tricky, honestly, because there are laws in various states now that are protecting that information. So it's going to be a little bit tricky, and I can't really provide any legal counsel on that because it's going to be obviously challenged in the
Mm.
courts. And then anytime that you are keeping track of something and monitoring the kind of PPE you're using, any respirators, anything like that, you'll want to make sure that you have reports of things like fit testing or cleaning, disinfecting, that kind of thing. So keeping good records and then giving periodic reports to your quality assurance committee is going to be part of this process. You'll want to monitor the effectiveness of your plan. And by that, what I'm thinking they want to know is, so you have this plan in place. Are you seeing cases either in your patient population or in your employees
Right.
where it appears that it could have been transmitted internally?
Mhm.
Also, they want to know if you're having to coordinate with other employers. How are you doing that? How are you communicating? And an example of that would be if you have patients in an assisted living facility or that type of a setting, And there are employers, obviously, that, keep another whole layer of staff in that particular facility. How are you coordinating with them to make sure that you're working together using basically the same approach? And then how are you entering various residences for your patients? Are you able to, I'm thinking, if it's just a single family home, obviously you want to make sure that if there's anyone in that household who has been exposed. And if so, then you'll want to try and eliminate their presence during visits. So, anytime you're going in and out of the home, do you have to put on PPE at the door? How are you going in and out? And that would be a pretty straightforward policy or protocol for donning and doffing PPE, that kind of thing.
Oh man, I haven't heard the word doff since I read a Charles Dickens novel. That's so fun.
Oh, well, in home health or in the healthcare industry, donning and doffing are pretty common. So,
Wow. Thank you guys for bringing it back. Don me now our PPE apparel.
oh, that's funny. But yeah, there's very few people probably in the home health world that are not familiar with that.
Well, that's fun. All right, what else?
Well, and the last part is the signature and plan availability. And again, that just requires that you have a hard copy of the plan at your primary business office. And if you have other kinds of digital information, like you have a website or you have, something else that you communicate on, it would be a good idea to have either a brochure or some kind of a statement that you have a COVID-19 plan in place to protect your employees and in our case, patients. So that's kind of an overview of the things that need to be covered in the plan. But I would just say, ideally, go to the website that Amy has put on our site and just, methodically go through and answer those questions and kind of see if you can be specific about how you would implement that in the home health arena. Or if if your agency is a hospice agency, the same would apply. So it's pretty much the template walks you through the process, but you just have to make sure that it fits your particular agency. The other thing I would say is, even though this is supposedly a temporary situation, we have no idea how long this is going to go on, and it very well may continue on with other kinds of variants. So it's important not only to have the plan, but to make sure that your agency's policies and procedures match up with what you're saying in the plan. How does the person responsible for this plan get a report to someone else in the organization? Is it tied in through your quality assurance program, which is probably where I would say it belongs? So you may want to add to your QA program and include a report, on this particular issue. Normally I'd say quarterly, but if you meet monthly, I would say, include it every time you meet so that you can really monitor the effectiveness and see if you're having any internal cases or if you're seeing any kind of spreading within your patient population.
Okay.
So
Yeah.
that's
Right.
really all I had to cover today. I just wanted to mainly make sure that people understand that even if you had a survey, a Medicare survey and or accreditation survey, sometime this year in the earlier months, don't think that you're safe from OSHA because OSHA is doing their own surveys, they're doing their own audits. And even though I don't know of any agency that has reported that they've had one, I have heard from some of my colleagues that are consultants that they're happening. So if you don't have a plan, just make sure that you get one in place and that if you're asked, you can provide it in writing.
Unless you have 9 employees, then
Or
you can do
less.
whatever the heck you want. Um, if you're not ready, get ready. That's the message today.
Yes.
What's the bottom line on this? I know everybody just wants to toe the line anyway because they're home health heroes and that's how you guys roll. But is this stuff that gets fined? Is this stuff that gets you shut down? What
This is
level?
stuff this is stuff with really big fines.
Okay,
Yeah.
yeah. So don't get big
Uh,
fines.
yeah, I think I've heard the number $14,000 per occurrence per situation. So it
Okay.
could wipe out a small agency very
Pocket
quickly.
change. All right. Yeah, then everybody be buying their own PPE. All right. Well, that's
So
all we have
again,
for you. Oh, go ahead, Mama.
I was just
Sorry.
going to say, so go to the website that Amy is putting on our Facebook page and make sure that you just go through it. If you're not the administrator, make sure that you are aware of whether or not there is a plan in place. And you should have been trained on it. So if you haven't been trained on it, that's probably a good sign that your agency probably doesn't have one yet. They
Mhm.
should
Mhm.
have one, but having been there, done that, I am well aware that sometimes agencies either are not aware of the requirement or just have not had the time to take care of it.
Yep.
Obviously, they are being inundated with all kinds of new stuff, new information, constantly changing information. So, if your
Yeah.
agency does not have one, uh, just pitch in and help develop it.
Yeah. So that link is in the description box of this broadcast, both on Facebook and YouTube. So if you join in or watch this later, that's what that link is. Um, you can follow along looking at that, grab it and then follow along while mom talks about it. And yeah, start working on it. Unless you have 9 employees or less, then you don't have to do it. All right. Well, that's it for us today. Come on back next Friday. We'll have another Q&A session for you. If you've got any questions between now and then, the best way to get a hold of Teresa Register, the home health mentor, is by going to her Facebook page, which of course is facebook.com/the home health mentor. Don't go to just home health mentor. That's another person who's not as cool as my mom. So we'll see you over there. And do remember that she's got some freebies up on her website, thehomehealthmentor.com. And if you haven't subscribed to the newsletter, that's kind of where we keep you up to date with new stuff. You can also do that through the website. So thanks for hanging out with us today. Michelle, thanks for your feedback. We will listen and repeat if it's really terrible. And if not, you're going to be stuck with it. See you guys next time.
Thank you. Bye bye.
Bye.